Imagine waking up each morning with aching joints that just do not want to move. Or perhaps you have a persistent swelling in your knuckles that seems to come and go, leaving you wondering what is truly going on inside your body. It is easy to dismiss these aches and pains as just a part of getting older or a result of everyday stresses, but sometimes your body is trying to tell you something more specific. When your body shows persistent, unexplained joint pain, swelling, stiffness, and fatigue that last for more than a few weeks, these are strong signals that it is time to consider a visit to a rheumatologist. These specialists are experts in diagnosing and treating conditions that affect your joints, muscles, and bones, particularly autoimmune and inflammatory diseases. The reason these specific symptoms point to a rheumatologist is because they often indicate underlying inflammatory or autoimmune conditions, rather than simple wear and tear arthritis. Conditions like rheumatoid arthritis, lupus, or psoriatic arthritis involve your body's immune system mistakenly attacking its own tissues. A primary care doctor might initially assess your symptoms, but a rheumatologist has the specialized knowledge to identify the subtle distinctions and run the specific tests needed for an accurate diagnosis. Early diagnosis of these conditions is crucial, as it can prevent irreversible joint damage and help you manage symptoms effectively. So, how do you know if your symptoms warrant this specialized attention? Pay close attention to morning stiffness that lasts longer than 30 minutes, especially if it improves as you move throughout the day. Notice if your joint pain is worse after periods of rest or inactivity, rather than with activity. Look for joints that appear visibly swollen, feel warm to the touch, or show redness, particularly if these symptoms affect multiple joints on both sides of your body, like both wrists or both knees. Unexplained fatigue, persistent low-grade fever, or skin rashes, alongside joint issues are also significant red flags. Keep a simple diary of your symptoms, noting when they start, what makes them better or worse, and how long they last before your appointment. It is important to understand the difference between mechanical joint pain, like that from common osteoarthritis, and inflammatory joint pain. Osteoarthritis typically worsens with activity and improves with rest, and it is largely a wear and tear condition. Inflammatory arthritis, on the other hand, often improves with movement and worsens with rest, stemming from systemic inflammation. A rheumatologist excels at differentiating these distinct causes, which is key to getting the correct treatment plan. They can also explore conditions like fibromyalgia or gout, which present with their own unique patterns of pain and inflammation. Recognizing these specific signs and proactively consulting with a rheumatologist can make a profound difference in your health journey. Taking action when you notice these persistent inflammatory symptoms allows for timely intervention, helps preserve joint function, and significantly improves your overall quality of life. Do not let unexplained discomfort linger. Listen to your body and seek the specialized care you deserve.